Think about it, you hear most commonly of like a sprained ankle, right? Or you strain your groin muscle, or you strain your hamstring, something like that. So sprains are ligaments, strains are muscles and or tendons. Okay? And then both of those types of injuries are divided into 3 different grades. Okay? You can have grade 1, grade 2, grade 3. So here we're talking about ligaments. And then grade 1 is where you have some stretching and maybe a little bit of tearing of the tissue. But those are the types of injuries where you can just bounce right back. I mean, you might be a little bit sore, but there's no real permanent tearing or damage. Okay? Then when you get to grade 2, that's where you have fibers actually are starting to get torn. So you have some partial tearing. In the case of a ligament, it's a sprain. In case of a muscle, it's a strain. But they're still done on the same grading scale. Okay? Where, let's say you're getting anywhere from partial tearing all the way up to 50%. Okay? When you start talking about 50% or more, then you're talking about grade 3. Okay? Grade 2, you may not have instability of the joint. Because what do ligaments do? They help stabilize joints, right? So if you tear your ligament or you overstretch it, you're going to have laxity of the joint. So it's not so much going to happen with grade 2. But when you're talking about grade 3, that's when you're going to have instability of the joint. Okay? Has anybody ever had any significant ankle sprains or other knee injuries or something like that? Is that more on one side than the other?
Only on the right side.
Yeah, so is your right side looser than the other?
Yeah.
And then there's certain orthopedic tests that you do to check those ligaments. Okay, there's like drawer signs. Actually, the drawer sign in the ankle is another drawer sign in the knee. And basically what you're doing when you're checking the ligament is you're seeing how well it moves. And most of the time when you're dealing with extremities, it's convenient because you have another side to compare it to, right? So if somebody has one side that they've injured, you can compare it to the other side. And you do the different orthopedic tests. And then basically here's some information about muscle tears, where it talks about grade 1, grade 2, grade 3. So basically you understand the difference. Grade 1 is not really a permanent injury, it's just a slight tearing or stretching of the tissues, and then it pretty much will bounce right back. Grade 2 is where you're starting to talk about more significant tearing, but you may or may not have some laxity in the joint. Grade 3 is where you're talking about, over 50% tearing all the way up to complete tearing of a ligament or a muscle. Usually if they have a complete tear, it's not going to hurt anymore because those pain fibers aren't left there to irritate. Okay? If there's still something hanging on, then you can still have some pain. But a lot of times if it's a complete rupture, it's not going to hurt anymore. But it'll still be swollen and the joint won't be stable. So then we talk about predisposing factors to muscle strains. Right? Now, how many of you before when you got up to warm up this morning did you do this pose, right? Not so many, I don't think. But the idea is that if muscles have had previous injuries, they're going to have scar tissue and there's going to be more likely to be injured, right? And then also if you warm up a muscle first, you're going to be less likely to be injured if you start working from the cold. So a lot of these are just common sense types of things. All right, so now we're moving into the actual leg. Okay? So you remember we talked about the thigh. We had different compartments. We had what compartments did we have in the thigh? Anterior, posterior, and what? Medial. What do we have in the leg? Anybody know? Well, let's take a guess. You're probably going to have an anterior, right? Is there some muscles right here? What about on the back? Pretty big muscles right here. Now you got a 50-50 chance. Is it going to be medial or is it going to be lateral? Lateral. Okay? So there's muscles on the lateral side. So we're going to have an anterior compartment, posterior compartment, lateral compartment. Okay? So, and it's fairly comparable to the forearm, except in the forearm we only had 2 compartments. But the idea is that when we had these 2 compartments in here, we had some muscles that were superficial and some muscles that were deep. Okay? And we're going to have the same thing in the leg as well. So when we talk about the thigh, what do we call the tissue that went all the way around the thigh? Yeah, fascia lata, and then you have the tensor fascia lata. So we're still going to have some kind of a continuation of that down into the lower leg. So there's fascia that surrounds all the way around the outside. And so then, like it says in the notes there, the fascia of the lower leg is continuous with the fascia lata of the thigh. And then it's going to separate into 3 different compartments in the lower leg: anterior, lateral, and posterior. And then, you remember, what was the thickening of the fascia that we had around the wrist here? Retinaculum. And then on this side, what did you call it? What's this motion? Extensor, or maybe they call it posterior retinaculum too, and then it could be flexor or anterior retinaculum. So in the ankle area, they're going to have the same kind of thing. So you have a flexor and extensor retinaculum, and then the fibular retinaculum, which would be for the lateral compartment. Okay? So then when we talk about the motions that are going to occur at the ankle and foot, so what do we call, if this was the tibia here, what do we call this? Is it dorsal or plantar? This is plantar aspect, so it's plantar flexion, and then this would be what? Dorsiflexion. Okay. And then what do we have on the toes? So if I go this way, what's that? Flexion, extension. Okay. So if this is flexion of the toes, then like this, what we call plantar flexion is what actually is true flexion of the ankle. But to clarify it, we're talking about this plantar flexion is to point the toes. Dorsiflexion is coming up like that. Okay? And I'll talk about it more when we get into the foot. Okay. So then there's some other movements. What do we call if we do this? Inversion, eversion. Okay. So those are going to be the main motions, although there is another combination of motions, and we'll talk about more of that when we get out into the foot. You have pronation, which is like this, and supination. It's a combination of motions, and we'll get into that later when we get into the foot. It's more complicated than pronation and supination that we had in the forearm. So if we talk about the anterior compartment of the leg, so since I don't have it, well, I got it here. So the anterior compartment is going to be right here. All right. So if you put your hand on the anterior part of your lower leg, and then you bring your toes back up like that, feel those muscles contracting right here? They're a little bit lateral of center. So if you feel that crest of the tibia, they're a little bit just to the lateral side of that. Okay. And then we're going to have the most medial one here, and that's only going to grow into the metatarsals. Okay? Then we're going to have another one here that's going to go all the way into the toes. And then we'll have some other ones that are a little bit deeper. Okay? But the basic thing is the anterior compartment is going to do what? Does it do plantar flexion or dorsiflexion? Dorsiflexion. And then what does it do to the toes? Flexion or extension? Extension. Okay. Do you think there's going to be a special one that goes to the big toe? Probably. There was for the finger, for the thumb, so there's one for the big toe. If this one was called pollicus, it's the one in the toe. Hallicus. So you think there's going to be something like a extensor hallicus, whatever, and a flexor hallicus?